Hi everyone, it's Dr. Dave, and today we are going to talk about carbs. Carbs, carbs, carbs. That's all we ever hear about today. The question is this: do Americans eat too many carbs? And this is a question that's brought up in my mind because I recently came across a study that was published in the Journal of the American Medical Association a little while ago, looking at about 44,000 US adults 20 years and older. And this study showed us that the problem is not the amount of carbs necessarily, because Americans do consume a lot of carbs, but that's not necessarily a problem. The problem is the type of carbohydrates that we are consuming. We are so obsessed in this country with avoiding carbs. Carbs get such a bad rap, but do they really deserve a bad rap? And I would argue the answer is categorically no. Carbs do not all deserve a bad rap. Bad carbs, refined carbs, deserve a bad rap. And in this study, the study showed that 42% of American diet consists of low quality carbs. What do we mean by that? Sugars and refined grains and sugar sweetened beverages. 42% of the American diet consists of this stuff, these really low quality carbs. That's the problem. Only 9% of the American diet was made up of high quality carbs such as fruit, vegetables, and whole grains. So 42% bad carbs, 9% good carbs. And that is where we have the problem in this country. Carbs are not the problem. Refined, low quality carbs are the problem. So, what would I tell my patients in the office? And I tell them all the time. The trick I use when trying to figure out if a carb is good or not. We know vegetables and fruits and whole grains, these are good carbs, but what is a whole grain? Which vegetable, which fruits? This is how I tell people to approach it. Think of it in terms of fiber. The carbohydrate you're eating, does it have a lot of fiber? And if not, then do research, start educating yourself on carbohydrates that have high fiber content. If the carbohydrate has a higher fiber content, then it is probably a good carb and you can consume it. Okay, so we shouldn't demonize carbohydrates as bad. We need to be a little bit more sophisticated, and we need to ask ourselves, what type of carbohydrate should we consume? Okay, everybody, I hope that is helpful. Till next time, this is Dr. Dave.